So thank you for inviting me to come along today. It's really nice to meet you in the lunch break. So my name's Becky. I'm a clinical psychologist at King's College London, but I'm also an honorary lecturer at UCL in the Division of Psychiatry. And my main interests are talking therapies for older people. So clinically, I'm based in a community mental health team service in South London, and have been offering a variety of different talking therapy interventions for older people with depression, anxiety, but then also for people with dementia and their caregivers. And so what I'm going to be talking about today is a particular type of talking therapy that's kind of quite hot at the moment. So, I mean, who hasn't heard of mindfulness? It seems to be kind of only, who hasn't heard? Yeah? Just a few people in the room haven't heard about mindfulness. So it's a very hot topic, being introduced in things like in Parliament and in the army. So we're going to be talking today about mindfulness-based interventions for people with dementia and their caregivers, and ways in which you can bring mindful awareness into your daily lives. So first of all, I'm going to be starting off with talking about what mindfulness is, for the people who don't know what that is. We're going to then move on to talking about what it involves, and we're going to actually experience what it involves as well in this talk. We're then going to talk about how it's being applied to people with dementia and their caregivers, and as I mentioned, we're going to talk about ways in which you can bring this into your everyday life. So what is mindfulness? Well, certainly the most common definition that is used is that mindfulness means paying attention in a particular way, so on purpose, in the present moment, and non-judgmentally. And so what that actually means is that mindful awareness is all about being aware of our thoughts, of our feelings, our emotions, and our bodily sensations, without, so being aware of those from each moment, so in the here and now, without judging them, without criticising ourselves for having those particular thoughts or feelings, and with a sense of openness to them and a sense of curiosity about them. So it's about being open to whatever our experience is in this moment. Two principles that are really important in mindful awareness are these ideas about shifting from the doing mode to the being mode and coming out of automatic pilot. Now, shifting from the doing mode to the being mode, what that means is that it's about moving from a goal-orientated, achievement-focused, problem-solving approach to a mode of actually being with whatever we're actually experiencing. Now, the reason why there's this emphasis on this is that we know that the doing mode, so achieving things, setting goals, solving problems, fixing things, we know that obviously that is helpful and we all need to be able to do that. But there are times when that's not so helpful. So say, for example, if there's a problem that you can't fix, or if there's some things that you can't actually achieve. This is a way of, a different way of being with those type of examples. The other reason for the emphasis on shifting from the doing mode to the being mode is that all too often we can find ourselves trying to solve things, trying to actually achieve things, that we forget to actually appreciate or enjoy what's going on in this moment. So, for example, the cartoon here, we're so busy watching out for what's just ahead of us that we don't take time to enjoy where we are. So all too often, we're stuck in our heads, worrying about the future or ruminating about the past. And so actually, moving from the doing mode to the being mode, so appreciating the now, or seeing if we can be with whatever difficulties are there. That's why that's so important. Now, coming out of automatic pilot, what that refers to is a lot of our tendency to be on autopilot, to be automatically, routinely doing things without much awareness. So, I mean, who's had the experience of you might be eating a bag of popcorn in the cinema and just kind of sort of just shoveling the popcorn in, and before you know it, you've got to the end of the carton, and you kind of sort of think, well, how did that happen? With not much awareness of the fact that you've just eaten that. Or you might be on a bus and your head might be miles away, your mind might be miles away, thinking about things that have happened in the past or things that might happen in the future, and before you know it, you've arrived at your destination, and again, not really aware of how you've actually got there. So coming out of automatic pilot means actually stepping out of that automatic tendency to routinely, automatically do things, and to actually be more aware of what we're feeling, what we're thinking, what we're experiencing as we're doing things. Okay, now there are a number of misconceptions about what mindfulness is, and so I thought it'd be useful just to go through some of these today. So mindfulness is not about relaxing. So often we think that mindfulness is about just relaxing, being like this little kitten, but actually it's about being with whatever we're experiencing in that moment. We might feel relaxed, say for example when we're doing a meditation, we might feel relaxed, but then again we might not. And so it's just about being open to whatever our experiences are. Mindfulness is not about feeling no emotions. It's actually being open to all of our emotions, and as best as we can, seeing if we can be with those emotions, even if they're things that we don't like, things like anxiety or things like feeling low in mood. It's about seeing if we can just be with those, tolerate those feelings a bit more, because then we have a chance to be able to choose how to respond to them. When we're in this automatic pilot mode and we notice feelings that we don't like, our automatic reaction might be to try and get rid of those feelings. And actually what we know from both clinical practice and from research is that trying to push away feelings like anxiety doesn't really help. And so this is one way of actually being able to see if we can tolerate those feelings and then choose how to respond in a wiser way rather than in a knee-jerk fashion. Mindfulness is not about necessarily meditating while saying all that kind of thing. You can meditate at anywhere, and certainly you can use mindful awareness at any time, anywhere, so you don't need to necessarily meditate. And it's not a religion either, so it's got origins in Buddhism, but it's been developed as a secular intervention, and is actually available on the NHS for relapse prevention in depression as a secular intervention. It's not about brainwashing, and it's not about hypnotising people either. So the whole point about mindful awareness is that you're actually fully aware of what you're thinking, you're feeling, what you're doing. So it's not about hypnotism. And finally, mindfulness is not about emptying the mind, clearing the mind, stilling the mind, all of those kind of things. Those kind of things can happen when you actually meditate. You might have a brief period when you have a calm mind, and then because our minds naturally wander, you'll find that your mind will go off kind of onto all sorts of different thoughts. So it's not about clearing or emptying the mind, it's about just being with whatever you're experiencing. Okay, so we've talked a lot about what mindfulness is, but But one of the best ways to actually understand what it is to actually experience it. And so, if it's okay with you, what I'd like to do now is to actually guide you through a meditation. Now, you don't have to do this if you don't want to, but if you're open to experiencing this, then I'm going to guide you with some instructions now. Okay, so sitting in your chair and just adopting a posture that embodies a sense of alertness and wakefulness. So your spine is straight, your feet are flat on the floor, with your hands resting in your lap, and closing your eyes if that feels okay, or adopting a soft gaze a few feet in front of you on the floor. And just taking a few moments to arrive in this moment. Just taking a few moments to allow the busyness of what we've been talking about, what you've listened to this morning. Just taking a few moments to allow that to settle in your mind and your body as you move from the doing mode to the being mode. And just becoming aware of the contact between your body and the chair. So the sensations of pressure of your thighs, your buttocks on the chair. Becoming aware of the contact between the soles of your feet and the ground. Now moving the focus of your attention to the breath. So focusing on the breath as you breathe in and as you breathe out. Not trying to control the breath in any way, just allowing your breath to breathe as it normally does. And remembering that we're not trying to achieve any special state in this practice. We're not trying to relax. We're just aiming to be with whatever arises in each moment. So focusing on the breath moving in and moving out of your body. If it helps, putting your hand on your abdomen so that you can feel the breath moving in and out. And if you notice your mind wandering, as minds naturally do, then congratulating yourself for noticing this, and just very gently escorting your attention back to the breath. Focusing on the in-breath, the slight flaring of the nostrils as you breathe in, the rising and expanding of the rib cage, and the inflating of the abdomen as you breathe in. Focusing on the sensations of the out-breath. The gentle lowering of the abdomen, the belly, and the falling away of the rib cage. And the sensation of air passing out and down through your nostrils as you breathe out. And if you notice your mind getting caught up in thoughts, images, daydreams, and just acknowledging where your mind has gone, and very gently bringing it back to the breath. And now expanding your awareness out to sounds. To sounds inside the room, to sounds outside the room. As best you can, noticing sounds just as sounds. So noticing the pitch of the sounds, high or low. Noticing the volume of the sounds, quiet or loud. Noticing the rhythm of the sounds, regular or irregular. Now letting go your awareness of sounds and just returning your attention to the breath. And as we come to the last few moments of this practice, bringing this sense of expanded awareness to the next moments of your day. So just opening your eyes and coming back into the room when you feel ready. And moving your body in any way you feel that you need after sitting. So that was just a very short 7-minute meditation there. Would anybody like to share their experience of that practice? So you found it quite relaxing? Great. And so of course it's important to remember that you might find it relaxing, but there are definitely times when you don't feel relaxed. And so it's not about, if you don't feel relaxed, then it's not that you've done something wrong, it's just that's your experience at that moment. Anybody else like to share their experience? No, that's definitely. So what, just in case anybody didn't hear, what the gentleman was saying was that he'd been given a book and that it's by an American, and so finds it difficult sometimes focusing on the voice. But today, what he experienced was falling asleep. And he mentioned that's okay, and that is perfectly okay. So a common side effect of meditations are falling asleep, and what is crucial is how we actually respond to that. So instead of, oh no, I fell asleep, oh I'm so stupid, oh I got it wrong, oh I can't do this, oh it's ridiculous, instead of actually having those kind of thoughts, being, oh well, I fell asleep, that was my experience. And as you say, yeah, that's okay. If you find yourself falling asleep all the time, then what we say then is kind of to actually change it to a different part of the day when you're less likely to fall asleep. Okay. So what the lady was saying was that they've been to yoga classes where they do something similar to this, and obviously part of yoga there is some kind of meditation often, and she's saying that her husband doesn't usually like it, but today he did like it. Was there anything in particular that struck a chord for you. So it's good not having to do anything. So yes, actually giving yourself permission to slow down and to not actually have to do something can be quite refreshing, because we're so used to trying to get things done and trying to achieve things, trying to solve things, that actually giving yourself that time can be really helpful. Thank you for sharing that. So in terms of what mindfulness involves, what we can see from that brief meditation practice is that it's actually about training our attention. And so it's about focusing our attention on different aspects of our experience. So for example, it might be our breath, it might be the body, or sounds, or thoughts. It's about noticing, and when our attention wanders, which it will inevitably and naturally do, no matter how many years you've been practicing meditation, your mind will always wander, because that's what it does. But it's about noticing when your attention has wandered, and then noticing how you react to that. So do you beat yourself up, for example, by thinking that you're not doing it right because you can't keep your mind still? Or do you have a more accepting frame of mind, where it's kind of like, oh well, today is one of those days where my mind is like a ping pong ball. So it's about noticing how you react to your attention wandering, returning the focus of your attention back to whatever you were focusing on. So when I was guiding, I was saying, but if your mind wanders, then just notice where it's gone, bring it back to the breath. And all of this is in the context of using the breath as an anchor to guide us back into the present moment. And the reason that we use the breath as an anchor is because obviously in each moment we are breathing. It's something that is very tangible, that our body is breathing right now, so we can focus on that. So in terms of mindfulness-based interventions, we often talk about two types of meditation: formal meditations and informal meditations. The formal meditations are things like this is the body scan. So that's about lying on the ground and focusing your attention on different parts of the body. The sitting meditation, which is what we just did, is about focusing the attention on the breath, on the body, on thoughts, sounds. This one down here is what we call mindful movement. And mindful movement can be just something as very simple as just putting your arms in the air, or even just putting your hands together and just feeling the changes in the muscles as you move your hands. And then a final meditation is the 3-step breathing space that we're going to come on to later. So it's a very short, brief meditation. We also then encourage people to engage in informal meditations. So these are basically being mindfully aware during daily activities. So, for example, being mindfully aware when we're eating, and when we're listening to things, seeing things, and then also things like walking. And I'm going to go through some of those aspects of how you can bring that informal mindful awareness into your daily life soon. So in terms of what mindfulness-based interventions are, well, they were originally developed for people with chronic health conditions and for chronic pain. So this is originally mindfulness-based stress reduction. And it was then adapted to people with depression to form mindfulness-based cognitive therapy. And actually, as I mentioned earlier, MBCT, mindfulness-based cognitive therapy, is available it's recommended in the NICE clinical guidelines for relapse prevention in depression. Mindfulness-based interventions, they've been applied to a variety of clinical and non-clinical populations. So as I was mentioning, a range of different physical and mental health conditions, but then also people in the army, people in parliament. And there have been adaptations to the groups, for example, for people with dementia that we're going to be talking about shortly. There are all sorts of health benefits that research studies have shown in all sorts of different areas, from improving feelings of depression to reducing blood pressure to improving attention and to reducing things like substance use. So lots of different ways in which studies have found that they're beneficial for our physical and mental health well-being. So in terms of actually mindfulness interventions in people with dementia, there have only actually been a handful of studies that have started to look at this. And one such study is by Quintana et al. And they did a randomized controlled trial where they compared cognitive stimulation with muscle relaxation, with mindfulness, and then with a usual care control group. And what they found is that in the mindfulness group, they didn't see a deterioration in cognitive functioning that they did in other groups. So just this slide here, what we can see, so this is over 2 years. So the mindfulness group, they had relatively stable performance. So a lot of these, you can see these bars are very similar in length. But for the other conditions, what they found was that cognition overall deteriorated. So there's some evidence to suggest, I mean this is a small study, but some evidence to suggest that certainly in mild to moderate Alzheimer's disease, so people with MMSEs of 18 and above, that it was able to kind of stop some of that deterioration. The study by Pala et al. Is actually one of the very few studies that have actually looked at a mindfulness intervention for people with dementia and their caregivers in the same group together. And what they found were that it was really helpful for improving depression, improving quality of life, and also it was helpful for attention. So there are improvements in attention in the patients. Now this wasn't a randomized controlled trial, it was just a before and after evaluation. So obviously we don't know whether these effects were due to non-specific factors like just being part of a social group, or whether they were due to a placebo effect, so the expectation that the intervention was going to help. But obviously the results are in line with what the other study showed. And then finally, this study, they conducted a randomized controlled trial of a mindfulness-based intervention for people with mild cognitive impairment. And they were interested in looking at brain functioning and brain volume. And what they found was that in the mindfulness group compared to the usual care group, that there was increased brain activity between the front and the back of the brain. And then they also found a trend, so it wasn't quite statistically significant, but they found a trend for less cell death in the hippocampus in the mindfulness group compared to the usual care group. Now, one of the reasons, it's a very small study, so obviously this kind of study just needs to be replicated more, but again, it's certainly interesting to see these kind of results. And we know that from other research studies that, for example, long-term meditators have changes in their hippocampi. They have greater volume in their hippocampi. So it's certainly suggested that mindfulness-based interventions can be certainly helpful both at the cognitive but then at the brain level. So how can you actually bring mindfulness awareness into your everyday lives? Well, there are a number of things that you can actually do. You can use mindful awareness in things like the informal practices that I mentioned earlier, so the mindful listening, mindful seeing, mindful eating. But you can also bring it into daily activities such as showering. So, for example, being aware of the temperature of the water on your skin and being aware of how your the temperature of your body that's not in contact with the water and that is, being aware of the sounds of the water splashing on your body versus splashing on the bath, for example. So lots of things that you can bring awareness to. You can even bring awareness to making a cup of tea. So when you go to pick up the kettle, being aware of the feel of the kettle in your hand and the weight of the kettle as you gradually fill it up with water. Being aware of the sound as it slowly boils. So lots of different ways, again, really bringing in all of the different senses, so sight, sound, touch, taste, all those different things, really bringing them into your daily activities. And then another thing you can do is the pause. Now the pause is a really useful way of stepping out of automatic pilot and coming back into the present moment. And so all the pause, it's very simple. All it involves doing is just stopping what you're doing, taking 3 breaths and being aware of the breath as it moves in and out of your body, and then just carrying back on with what you're doing. And you can even, with the pause, you can schedule it for regular times of the day, like when you get up first thing in the morning before jumping out of bed, or when you put on the kettle. You can also do it at times when you're experiencing difficulties. So the pause is a really useful thing to be able to do. And then the 3-step breathing space is an expansion of the pause where it's like a mini meditation. So where you focus your attention on whatever you're experiencing in that moment. So thoughts, feelings, bodily sensations. You then narrow the focus of your attention on the breath, and then you expand your attention back out to just noticing whatever's going on around you. Now, I was going to do the 3-step breathing space, but I think we've kind of run out of time to be able to do that. But you can, on YouTube, there are all sorts of 3-step breathing space. They're often called 3-minute breathing spaces, but it doesn't have to be 3 minutes. So there are various different audio MP3s that you can download. So in terms of further resources then, some really useful books that you might have heard of are Mindfulness, A Practical Guide to Finding Peace in a Frantic World. And that's by Mark Williams, who's a professor at Cambridge University. Now this book contains some guided meditations, but you can also download those for free. And the meditations are invariably around 8, 9, 10 minutes long. So if you're a beginner, new to meditation, then it's a really useful way to start. In terms of these 8-week, so mindfulness interventions are typically delivered in groups, in 8-week courses. And in terms of trying to access those courses, you can, if you're lucky, get them through the Improving Access to Psychological Therapies service. So that's through your GP. And it just depends on whether they've got somebody who's able to deliver those kind of groups in their service. There's also an online mindfulness-based stress reduction course that's free, and I've got the URL, the website address for that, so you can do that kind of thing. You can obviously pay for these courses as well, and the Be Mindful website has a search facility where you can look for independent practitioners near you. And so here are some of the websites that are useful, and then some videos that are particularly useful. So Healing from Within is a really old kind of 1980s video by John Kabat-Zinn, who developed mindfulness-based stress reduction. But it's a really great video, and this is the video that we actually ask people to watch during a mindfulness-based stress reduction course. So that can give you a really useful introduction to mindfulness. Okay, so I've come to the end of what I wanted to say, so thank you very much, and now I'm going to hand over to you if you have any questions about what we talked about.
while you're thinking about it, I was going to ask one of my own, which is, we've talked in this group quite a lot before that PCA, although it's characterised as being a visual problem, lots of people have sensory changes as well. So lots of people at these meetings have described particular problem with cold feet, or sort of headache or dizziness, or sense of sensation, something creeping up their back of their head, for example, sort of bounce and wobbliness. It's presumably important, as you were saying, that to embrace all of those sensations, even if we would in a normal setting classify them as being perhaps unusual or related to our condition. Is that right?
Yeah, definitely. So, I mean, whatever your experiences are, so whatever sensations you experience, as best you can, it's about bringing a sense of openness to them. So rather than trying to fight them, kind of like, oh, there's that tingling at the back of my head again, oh, I hate it, oh, and then, you know, muscles tensing, all that kind of thing. If you can actually relate to those sensations differently, for example, noticing, okay, I don't like this, I really don't like these sensations, but I'm just going to see if I can just allow them to be as they are. What it might give you the opportunity to then to be able to do is to sort of see that, say, for example, instead of thinking, oh, it's always there, you might notice times when it's not there, for example, or you might notice times when it changes. So just as with things like chronic pain, which was mindfulness-based interventions were originally developed for chronic pain, so just as noticing, for example, that there might be periods of time when you don't feel pain or that it subsides, the same kind of approach can be used with strange, unwanted physical bodily sensations.
So the question is about what do the mnemonics stand for? I'll allow you to explain.
So MBSR is mindfulness-based stress reduction, and MBCT is mindfulness-based cognitive therapy. And so mindfulness-based stress reduction was the original incarnation, and that was for people with chronic pain and physical health problems. And then it morphed into mindfulness-based cognitive therapy for people with depression. And that was bringing in some elements of cognitive behaviour therapy into that.
So the question is mindfulness the same as meditation, or is there a distinction?
That's a really, really good question, actually, and it's one that we often get asked. So there is a difference between meditation and mindfulness. So mindful awareness, you can practice at any time. You don't need to actually meditate. When we use meditation in mindfulness-based interventions, it's about a formal way of training our attention. When we think about meditation, for example, Zen meditation or things like that, that's not necessarily mindfulness-based awareness. Because one of the key things about mindfulness-based awareness is actually this whole thing about encouraging us to take an open stance to our experience without criticising ourselves, without judging ourselves. So if we have a look at this, slide, mindful awareness is all of these different things. When you're meditating, you might not be doing all those things. So there are some meditations, and excuse me if I get this wrong in terms of the name, I think it's Kirtan Kriya, which is being used for people with dementia. And this is where you go Satanama, 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 and you do that for 2 minutes out loud, 2 minutes silently, 2 minutes whispering, 2 minutes silently, 2 minutes back whispering, 2 minutes out loud. And you can see that something like that, Satanama, is a very much, it's called a concentrative meditation. You're really focusing your attention on something very specific. And they often don't talk about all of these different things, about the importance of being curious about your experience, being open to it. So that's where the difference lies. Absolutely, yeah. So you do meditation when you're in mindfulness-based interventions, but you don't have to do that in order to practice mindfulness-based awareness, and that's the really important.
So I think the question was probably heard by everybody, but just about whether this is something you can do together.
Yeah, so definitely. So the groups that I've run for people with dementia and their caregivers, I've done them with both of them in the room, and so things like the 3-step breathing space, that's been helpful. So in the last group, one of the caregivers was telling me about how he helped his mum go through the steps when she was feeling, for example, distressed. And then there are things like called a loving kindness meditation, where it's about wishing yourselves well, so wishing loved ones well, and you repeat a certain set of phrases, and again, that's something you can do together. But all of these things you can do together, but you can also, in terms of informal practices, so you can maybe, for example, asking, is it your mum you said? Yeah, so say for example it's your mum, you might be asking in the morning to, before she gets out of bed, take 3 breaths, so bringing the pause in. When you might give her a cup of tea or a cup of hot chocolate, before she goes to sip it, kind of asking her to really focus on the smell and what it smells like. Or what that piece of chocolate tastes like, so savouring, for example. So it's about kind of sort of using the senses to bring your awareness to your experience in that moment. And that's a really useful reflection, so thank you for sharing that with us. It is kind of, I think everybody I know, their common experience of when they start kind of meditating is the ping pong ball mind just kind of bouncing off kind of all sorts of different things, and it's difficult. And what's interesting, as you were saying, kind of was your reaction to noticing your mind wandering was, I can't do it, it's just too hard. And actually, so what mindfulness awareness is about is just noticing your reaction to that, and seeing if you can actually be open to that experience. So noticing your automatic tendency to beat yourself up, for example, or to say that you can't do it, and actually just then very gently just coming back to the breath. And so if you have to do that 1,000 times, so if your mind wanders 1,000 times, simply bringing it back to the breath 1,000 times, and just noticing those judgments that we all make. And as best you can, not buying in. You don't have to buy into those judgments. Yeah. Yeah. Well, certainly, I mean, one of the things we would say is not necessary, you don't even have to push them away, because it's not about clearing the mind, but they are only thoughts. And what this kind of, a technical term we often use in mindfulness is decentering. So it allows you to take a step back from your thoughts and to notice that you are not those thoughts, and that actually they can carry on, but they don't have any control over you. So you can have those thoughts, they can come into your mind, but you don't have to buy into them, you don't have to actually follow them or anything like that. So this is where mindfulness comes in. Does that chime with? Yeah. Thank you.
One last comment or question was just going to be about whether, in your experience, people who initially thought this would not be something for them gradually learn, either through practice or through understanding more about it, that perhaps it can be. Not to compare the two, but for example with this support group, I've had lots of particularly gentlemen who've sort of been hovering on the outskirts, or saying, oh yeah, I'll come, and then actually being really surprised that they actually enjoyed the experience. Though similarly, I presume there are lots of people who maybe just hear mindfulness and think it's some sort of hippie California thing. Yeah. For those of us, so do people? So two questions, I guess. So do people gradually kind of learn that it could be something for them? And if people decide that it isn't something for them, having made a sort of informed choice, what are there other alternatives or other techniques? Because presumably it's not for everybody. Yeah.
I think this is definitely a thing, kind of mindfulness-based interventions are definitely not for everybody, just as how cognitive behaviour therapy isn't for everybody as well. I think certainly people's experiences are that they can initially start disliking it, and then gradually over an 8-week course, what it often is that there are certain practices that they like and other ones that they find more difficult. So say, for example, some people really like the body scan, being able to focus on the body. Other people really hate that because they don't like noticing the sensations. And so it's about kind of finding what type of practice works for you. Other people don't like guided meditations, and they really hate the sound of someone's voice kind of telling them what to do. Other people really like that. So, and some people like the more informal practices, so the bringing the awareness into your everyday lives, whereas other people prefer actually setting aside a particular time with an intention to actually meditate. So I think the good thing about this kind of approach is that it's very flexible in terms of finding something that works for you. I think one of the things when we do the 8-week courses is that we know that not everything is going to chime with you, but if there's just one thing that helps, then that's great. In terms of other interventions, other talking therapists, I think the most commonly available one is cognitive behaviour therapy. And that's very much about challenging your negative thoughts. So we often talk about it, the 3 C's. Catch them, check them, change them. So catch the negative thoughts, check to see how valid they are, and then change them if you need to. So, and again, some people like that kind of approach. There are also problem-solving approaches that you can use. So all sorts of different types, but having access to those different interventions is one of the major kind of sort of issues. So if, say for example, you go to your GP saying that you're feeling anxious or depressed, then they would refer you to the Improving Access to Psychological Therapy service. And then if they've got someone trained in their service that can do mindfulness-based interventions, then you might be able to do it that way. But often it can be quite difficult. So even though it's in the NICE clinical guidelines, a lot of services aren't necessarily are able to offer this kind of intervention.
Becky, thank you so much for all the time, not just to come and talk to us today, but to prepare and to sort of think how this is a fit for us. So thank you ever so much.